talking about fentanyl today. The crisis has struck Vancouver and Western Canada. Hundreds have died, and it prompted communication between John Tory and his counterpart in Vancouver. As a result, John Tory is meeting municipal groups in our city on Monday next week to develop a strategy to deal with the fentanyl crisis as it moves eastward. Mayor Tory joined us this morning.
The mayor, Gregor Robertson, described not only the numbers. I mean, if you think about those numbers you just recited, 4 people a day, if that was going on with regard to a disease like a SARS type thing we experienced many years ago, or even what we've seen with pedestrian traffic deaths, we would be saying, well, we've got to do more than we're doing. But then also he described the traumatic impact this was having on the community, of course, on the families of those who are dying in the streets, and on people like first responders who were just finding, day after day, hour after hour, people in all different parts of the community dying from drug overdoses. So it was one of those things where I think it was traumatizing, as I would have expected, that community, and I just wanted to make sure I offered help, first of all, if there was anything we could do, but secondly, to get his advice.
And so the advice was, we don't need help, or there's nothing you can provide right now, but you should get prepared yourself. And as a result, you're calling a meeting for next week. What is that meeting intended to do?
Well, it's really trying to work on some of the great work that has been done already by Dr. Yaffe, our acting medical officer of health, and by Councillor Cressy, who runs our drug strategy. And, be ready, because that was the number one piece of advice that Mayor Robertson had for me. He said, look, it hasn't yet come. These drug patterns over the years have come from west to east in Canada, and it hasn't really come here in the same to the same degree as it has in Vancouver. And he said, be ready. And then he said, could I please help with regard to advocacy, because he really didn't offer any other alternatives for us to be helpful in terms of sending people or any of that kind of thing. And so this is really part of just making sure that we're as ready as we can be. And, a lot of the times when you have these kinds of problems, one of the obstacles that stands in the way of effectively dealing with them is different agencies that don't sort of have established lines of communication, or they have different protocols. So we're going to try and get everybody in the same room on Monday and, talk to them about the status of the problem in Toronto as of now, and make sure that we have an action plan that gets rid of any of those kinds of obstacles in the event that we end up with a problem as acute. And then secondly, I'm going to raise my voice. I mean, I'm privileged as the mayor of the biggest city in Canada to have a voice on these kinds of things. And even though it's in Vancouver, that's a Canadian problem. And I want to help Mayor Robertson, and I want to make sure that the governments, plural, are doing everything that we all can to stem this tide.
Well, let's talk about the scale of that problem. So in Vancouver, some people are dying of this without ever realizing they're taking it, because fentanyl has been laced into other drugs. What is the likelihood that the crisis, and that's the word that they use now in Vancouver, is likely to repeat itself at the same scale in Toronto?
It's hard to know, but one of the things Mayor Robertson educated me on was the fact that this has spread from a problem that was affecting a known community of people with drug addiction problems to so-called recreational drug users, in that, as you said, the fentanyl was being cut into other drugs that people use on a more random basis across the city. And a lot of the overdose deaths they were seeing in the month of November, when they had more than 100 in a month, were people who were not in the traditional places and so on, but rather spread across the city. And so it's one of those things where I think it can sneak up on you, and I just want to make sure that in Toronto, first of all, I mean, you'd like to do everything you can to make sure that doesn't happen, but if it does happen, that we're ready for it, and that we start to advocate a bit louder on one of the things, for example, that he identified to me in this exchange of emails that continues to this day, which is that there are inadequate treatment facilities for people with drug problems, and that is a contributing factor to this as well.
Yeah, so I want to talk about that, because a lot of the stuff that we hear about from Vancouver is reactionary. So the police, the firefighters, the paramedics, all now carrying naloxone, that sort of antidote to bring effectively the dead back when they have overdosed on fentanyl. What are the things that we can do that are proactive as opposed to reactive in Toronto?
Well, I mean, the naloxone thing is not unimportant because, as you suggested, it's one of those things where when people are in an overdose situation, they can be resuscitated. And I think we have to look at, whether it's really available or not. I mean, and I think it has to be available in the hands not just of, established kind of drug clinics or whatever, but also in the hands of first responders to some extent, even people who are social housing activists, because there are places where we're going to find some of these things happen where you'll want to be ready.
Would you like to see all first responders? Would you like to see all first responders carrying naloxone in Toronto as they are in
what
Vancouver?
I'd like to see before, I think that's something we're going to discuss Monday. What I'd like to see is just the sort of the practicality of this availability really being addressed. Because while we say that there's no legal impediment in the way of people having these kits, the fact is they're not as readily available as they need to be if you have a problem of the scale of Vancouver. But I think then you've got to move through that to residential treatments. We've got to make sure we move ahead with our plans that have been so overwhelmingly endorsed by City Council to have supervised injection sites, because I think that, in a way will kind of help with some of this, at least in terms of people being not in an alleyway by themselves if they end up in an overdose situation, but rather being in a supervised setting. So I just think all of this is what we have to do, and I hope that the meeting on Monday will also result in some degree of public involvement and consultation in this too, to see whether the public has some ideas on how we can address what is it's a simple matter, David. People are losing their lives by the hundreds in Vancouver, even in Ontario, where the numbers are quite out of date. In 2015, 154 people across Ontario lost their lives from this very same thing. So this is not confined to the West, but it's a crisis in the West. I want to help them by raising awareness of this and advocating, but I also want us to be ready in case it comes east, as it often has in the past.
So if it is a national issue, how constrained are we as a large city to actually deal with it? I mean, we're a big region, absolutely, but if this is becoming a national crisis, it is something the city alone should be dealing with.
Well, we have responsibility for public health, and a lot of the things delivered on the ground in this country are delivered, in fact, by cities. It's one of my great frustrations is that, cities actually deliver a lot of these things and are responsible for, the actual sort of on the ground addressing of these things, and yet we have to sort of half the time go begging somebody else to either get money or get help. But look, by getting everybody in the room on Monday, then I hope what we'll form is this partnership under the continued leadership of Dr. Yaffe and Councillor Cressy, with my very vocal help now, to do whatever we have to do, both to help on a national basis and to address this locally, to make sure that we do as good a job as one possibly can to save lives, which is, in the end, what this is all about.
Mayor Tory, thanks for your time this morning.
David, thanks very much.
That is Mayor John